Hello, good afternoon. Welcome to my presentation. My name is Jeanelle M, and my topic is raising breast cancer awareness among Black women. This is a final presentation that I came up with for the classes Nursing 635, Nursing Research, and Nursing 629, transition to professional practice. So welcome. Okay, so to begin, we are going to start off with the identification and significance of the problem. So the problem that I looked at in research is that breast cancer mortality rates among Black women are higher than any other race. A study between 2015 through 2019 shows mortality rates are 41% higher among Black women when compared to white women. And this study was authored by Lovejoy et al. In the year 2023, so it is very recent. This study also showed that incidence rates have remained consistent. However, mortality rates among Black women have been frequently higher. So the mortality rates show that there is a major health disparity today. The fact that incidence rates have remained consistent, but yet mortality rates among Black women are frequently higher, is a public health issue, and awareness and education are the key to start addressing this issue. Okay, so for my change theory, the one that I found that I thought would be applicable throughout my presentation was Lewin's change model, which was developed by Kurt Lewin, a renowned psychologist. So the first step of this theory is the unfreezing stage. So this means shedding light. So during this step, we're raising awareness of the mortality rate disparities when comparing deaths between Black and white women. Step 2 of this is the changing stage. So this step includes implementing education and promoting breast cancer screenings in hopes of reducing those mortality rates. So for this part of the change theory, I was actually lucky for my preceptorship to work with the Black Maternal Health Center of Excellence here at CDU, which is geared towards women's health within the local community. And so my peers and I were able to create a magazine, an educational magazine titled Early Detection is Key. So in this magazine, we basically center of attention was breast cancer. And throughout this magazine, we basically added steps and graphics on how to do breast self-examinations. We highlighted the importance of mammograms. We provided mammogram locations lists. We emphasized breastfeeding, and we also cited research so that we hope to spread awareness and promote this education. So going back to the change theory, step 3 is the refreezing stage. So in this step, we continue serving the underserved populations with these new changes that we're implementing. We hope that that's the new norm, and we continue providing additional resources to combat these mortality disparities among Black women. So for my PCOT question, again, we're looking at these disparities. So this is a PCOT question that I came up with. Among Black women in the U.S., would the education of breast cancer prevention recommendations such as mammograms be effective compared to the lack of awareness in reducing mortality rates when compared to white women after 5 years? So here, basically, we are raising the issue of the disparities, and we want to raise awareness in hopes of seeing if this contributes to any difference in the mortality rates. Okay, so to start the review of literature, there's a lot of literature that looks at breast cancer mortality rates among women. They basically all find that there are in fact disparities, and women do have higher mortality rates. However, there's no conclusive reason as to why this is happening. Most of these studies do recommend for additional resources, additional education, raising awareness, and prevention. However, there's no definite answer on why this keeps happening. Some research conducted studies looking at various types of specific breast cancers and found disparities among them. So a study authored by Cheng et al. In the year 2020 found that in the United States, African American or Black women are more likely than white women to be diagnosed with poor prognosis breast cancers, particularly estrogen receptor negative, known as ER negative breast cancer. Another similar study authored by Turman et al. In the year 2023 found that in comparison to all other racial and ethnic groups, Black women have the highest percentage of stage 3 or 4 tumors at the time of diagnosis. Both the 5 and the 10-year survivals are worse in Black women when compared to white women. Moreover, authors Williams et al. In the year 2016 states that compared to their white peers, Black women are more likely to be diagnosed at a later stage and less likely to receive stage-appropriate treatment and more likely to have lower stage-for-stage survival rates. So another example was one by Jane et al. In 2022, states that Black women experience treatment delays for non-metastatic breast cancer more frequently than white women. So while all these literature and studies highlight the higher mortality among Black women, a lot of them also looked at the delays that some of these women experience once they do seek treatment, and unfortunately these women do face delays. They are also less likely to receive treatment that is delayed. Okay, so summary of evidence. In conclusion, breast cancer screening disparities are composed of personal, community, and policy barriers among Black women in the community, and this was again stated by Williams et al. In 2023. The evidence found that the women have negative perceptions of mammography screenings. Many women have fear, mistrust, and denial due to racial injustices in society. And breastfeeding may have a protective factor against breast cancer. However, there is lack of knowledge and lack of resources among Black women, making them least likely to continue breastfeeding here in the United States. This specific study actually states that breastfeeding was associated with a reduced risk of ER negative breast cancer. So again, suggesting that the breastfeeding may eliminate or serve as a protective factor. However, this same study did cite that Black women in the U.S. have lower breastfeeding rates when compared to white women. So thus, research concludes the need for additional resources and education among Black women when it comes to women's health. In conclusion, interventions are required at different levels to improve mammogram rates, in hopes of improving those mortality rates and diminishing those disparities. So the recommended best practice and plan of action. So first, of course, we want to promote breast cancer screenings. Research did make the recommendation for Black women to start screenings at 42 years old versus the general female population that should start at 50 years old. So it was recommended for Black women to start 8 years earlier. Second, we want to provide culturally appropriate care. So this means that clinicians should use a race and ethnicity adapted approach when providing services to people, so that they are more likely to understand the information, feel free to ask questions, and more likely to abide to the care. And third, we have timely access. So we want to provide timely access when it comes to mammograms and promoting this education. We want to eliminate these barriers so that women don't have to face any delays in treatment if they are diagnosed with breast cancer. These social barriers need to be eliminated, and a redesign of healthcare interventions is required to target education geared towards breast cancer awareness and the importance of free screenings within the Black community. So we want healthcare providers to understand how to maximize interventions by removing socioeconomic and any barriers Black women face to effectively reduce these disparities. Okay, so here is the policy and protocol that for practice change that I came up with for this presentation. I titled it Promoting Breast Cancer Awareness Among Black Women. And ideally, we do want to initiate this as soon as possible because we do want to start interventions very, very fast. So the policy would be that there are free monthly women's health fairs aimed at low-income Black women, and these fairs will include 2 nurses and 4 community workers. And in these fairs, we will seek to provide breast self-examination classes, provide mammogram appointments, and disseminate health education materials so that these women can come and just pick up materials and read at home if they'd like. The rationale for this policy is that mammograms and health education are key to early detection and improvement of health outcomes. Additional resources will target health disparities with quick interventions to disseminate information to the underserved areas. As research stated, information must be disseminated at quicker rates for these women that suffer from the lack of education or knowledge. Okay, so as far as my implementation and evaluation plan, for the implementation plan, healthcare companies will ideally send out the 2 nurses and community workers that I touched upon. So we also want to emphasize that these workers should be trained to provide culturally competent care. Again, these fairs will provide breast cancer education as previously described in the policy. During the fairs, we also want to obtain contact information from the women, just basic stuff like name, age, a contact such as phone number, email. And then we also want to have the participants complete a post-fair survey where we want to ask them what information they gained, if they plan on using this information, if they obtained a mammogram appointment. And then after that, part of the implementation plan is to create a 5-year follow-up. So this year 5-year follow-up will ask the participants if they continue to implement any of the education they gained at the fair and or they used any of the resources provided. So as far as the evaluation, the researchers will base it off that 5-year follow-up. Researchers can review the health promotion effectiveness and then compare data to the new local breast cancer mortality rates to determine if increasing health awareness, education, and prevention tactics have had any impact on the community. So again, as far as the implementation and evaluation, the research team would consist of the participants, data obtained from the participants, nurses could join this team, in addition to researchers, and maybe even professors, community workers, anybody that's involved locally and really knows the demographics of the area can participate and provide input as to how this plan is laid out and how it is being worked into the healthcare system. So in conclusion, the higher mortality rates among Black women is a major public health issue that requires immediate interventions. Changes must be made to better breast cancer outcomes among Black women and eliminate hardships they face. This is a human right. So I also want to conclude that I am very proud of the work that we were able to do with the Black Maternal Health Center of Excellence at CDU. Aside from the magazine, it was we did apply the culturally competent concept when we were designing this magazine. We wanted to ensure that Black women were represented when it came to the colors, the graphics, little things like that. We kind of put this plan into work so that women can feel included when they are reviewing these materials that we created for them. And we also kept in mind that we want to maintain the words as simple as we could. There were portions we did include literature review, and of course that was cited. So yeah, hopefully you guys get to see those magazines around campus, and I want to thank you for your time. And here are my references. Thank you so much. Take care.